how have you been since I saw you last?
Yes, so I think I either saw you in Feb or November. There was still a bit of hardness around this bit, and then last 2 months was just under a year. It's all gone soft now, so I don't have any issues with that, which is great. But yeah, like everything's been fine.
So your nose shape and the hardening is all settled down, and so this is like your final appearance now, 1 year post-op.
Yeah.
And has anybody made any comments about your operation?
No one knows I've had a nose job, which is great, because my main concern getting my nose done was purely because if you get it and it looks completely different or it doesn't suit your face, which is great because it literally looks exactly the same from the front, which is exactly what I wanted, but it's that side portfolio where it's kind of come back as well, which is great because that's the bit I was really self-conscious of. And it was weird at first getting used to it because I was always so self-conscious, but I was still subconscious because I thought it looked like what it used to, but now I know it doesn't. Like, I don't worry about it at all, which is great. And like I said, no one knows that I've really had it done unless they...
Well, you had 3 millimeters nose shortened and 3 millimeters taken back, and then 4 millimeters hump reduced.
Yeah.
So it's all balanced, just it's made it smaller.
Yeah.
But many people probably may not have noticed it.
Yeah, no, it's great. It's awesome. Like I said, if I point out my scar, which is minimal anyway, but most other surgeons that I saw prior to you anyway, they all wanted to cut around here.
Okay.
Which obviously that kind of deterred me, so it put me off for a few years. And then
I do not perform that cutting on the side operation routinely because it leaves a scar here.
Yeah, and that's
some patients may complain about the scars.
I think probably as a guy as well, if you don't wear makeup, maybe it's a bit more of a deterrent as well.
Yes.
Because I guess with like people that wear makeup, you might.
So have you had any positive comments from anybody?
When you show the comparison, because like I said, it's very subtle, which is great, because like I don't want it to be like this whole thing like, oh, you've had a nose job, it's completely different. It was a very personal thing for me. But when I show them the pictures before, like even I didn't even realise when you mentioned how my lip bit was attached a lot further on the nostril.
Yes.
So even bringing that back makes my face look even better, not just because of the nose, but the lip bit attaching to the nose as well, which looks great.
That was 3 millimeters.
Yeah, so a lot of people have complimented on that and they said that's actually crazy how different it looks. But yeah, it looks great. I'm really happy with
That's
it.
very good. I was about to discharge you, but you mentioned to me something about a smell.
Yes. But it's a subtle smell, but if I like move my nose or if I do that, I smell like it's hard to kind of describe, but it just, smells a bit weird. But I used some saline stuff for a bit when I saw you last, and you mentioned that it might be something to do with the stitching coming out, the dissolvable ones. And then I guess we just had a chat as well to talk about maybe just there might be an infection or something there, so we're going to try some creams, but you checked it out, it looks all good. So.
Yes, I can't really see any foreign body like a suture material, so we'll try some antibiotic cream for your turbinates, they're a bit up, and hopefully that will sort it out. And I will see you again in a few months' time, just to make sure that you're absolutely happy with the progress.
Yes, that's awesome.
Okay, thank you.
Thank you.